Hi, good evening. We are discussing about the sports medicine, martial arts, which are very common nowadays, injury and prevention regarding the arts that we are going to discuss today. Now, martial arts are a popular form of exercise that you know. It is a sport which is worldwide. There are different variations in different countries as per the different customs, but grossly, martial arts are played everywhere. After the soccer, that is football, judo is the most practiced sport in the world. There are hundreds of different styles of martial arts, each being mechanically, philosophically, culturally, and geographically diverse. It is different in each and every portion of the world. In the United States, there are estimated 8 million participants in martial arts, with taekwondo and karate being the most popular. Now, what are the common martial art injuries? Martial art injuries can result in a wide array of injuries. The injury type is often dependent on the particular form of martial art being performed. Many of the martial arts are actually non-contact, and this tends to result in overuse injuries also. Contact martial arts vary in their techniques, rules, protective equipments, and these factors as a whole, all the things, the techniques, how much contact is there, what are the rules are applied, what are the physical contacts that are present during playing, and what are the protective equipments which are permitted while playing, that all lead to the overall environment where injury will depend and the injury rate will depend. Now, the most common injury is the concussion. Concussion is there is a head injury, or it is not that the head injury is that neurosurgery or everything is required, but definitely the injury to the brain stem and frontal portion of the brain due to the movement during the concussion injury leads to headache, dizziness, nausea, balance problem, difficulties with concentration, memory problems. It can last from several minutes to days, weeks, months, and even longer. It emphasizes striking and throwing are more likely result in concussions. Any athlete with symptoms of concussion should be removed from the play. અત્યારે તમે ક્રિકેટમાં પણ જોતા જ હશો કે જ્યારે પણ હેડ પર હેડ ઇન્જરી અથવા તો બોલ હેલ્મેટને પણ વાગતો હોય છે તો ફિઝિયોથેરાપિસ્ટ આવે છે એને પૂછે છે. રિસન્ટલી ઈશાન કિશનને પણ આ ઇન્જરી થઈ જતી, and it has to be evaluated by a health professional, and then he is permitted or he is rested during the period which he recovers fully. So they should not be allowed to return to play until they are cleared by the qualified healthcare professionals. And second thing, when the symptoms are absolutely gone. The second critical area during the playing, as you see in the picture, the injury can happen to the head, eyes, ear, nose, striking, and grappling with minor injuries like cut, bruises, lacerations, or it can be a serious injury such as fractures of the nose, face, or skull, as well as significant injuries to eyes, mouth, or teeth can also result. Again, the type of sport and type of the contact will definitely determine all these things, but it can happen. And these injuries may be minimized by the selection of martial arts style, proper training, coaching, and use of the protective equipments. Neck minor injuries to the neck as bruising, abrasions, they are very common. However, well, sorry for the interruption. And in some form of martial arts like judo and mixed martial arts, there is choking techniques also, but they are very dangerous and it has to be learned as well as the practice. And during the injury, while actual play is going on, we have to be very precautious that choking can lead to death also. Extremity injuries again are very common due to cut, bruises, sprains and strains. Fractures and joint dislocations are also common, particularly in the styles that use throws and joint locking techniques. Injuries can be minimized with the proper supervision and use of appropriate techniques. Skin cuts are fairly common injuries in martial arts. Athletes participating in contact sports like wrestling and martial arts can be prone to developing certain skin infections also. These injuries should be evaluated and treated by healthcare professionals. Now, there is a pre-participation physical examination and clearance evaluation before participating, so that the persons who are capable of going in the participation of the martial arts training, they should participate. Second thing is use of proper gears like gloves, mouthguard, headgear, chest protector, padding, and bracing. Definitely will guide us to prevent the injuries, and there has to be a sub strategies for preventing injuries. The most important thing is that martial art injuries should be prevented, and that is one of the most important aspect. Always train and practice under direct supervision from an experienced teacher. And most important thing, once again, experienced teacher, follow the teacher's guidelines, do proper warm-ups and cool down during the routines, and all the stretches, strength, endurance exercises you should perform regularly so that you are not prone to the injuries. So, welcome, dear sport person. Make yourself better for the game. Anytime you can consult us at J. Marias Gandhinagar Medical College, attached orthopedic department, and in sports medicine, you know that our goal is to help every athlete to achieve their maximum level of performance. And again, that is possible only and only when we prevent the injuries or treat them in a better way, and definitely with a good rehabilitation program. We have also a very good physiotherapy department also, where you can rehabilitate yourself and you can reach to your goal also. So prevention of the treatment, prevention of the condition, treatment of the condition, rehabilitation, and again regaining your full strength. These are the core values as far as the sports medicine is concerned in any sport. Thank you.